Okay. Hey, good morning, everyone. We appreciate you joining us today. I know there's still a lot of districts that are closed across Ohio, and it's a snow day for some. And so we appreciate you hopping on. We'll give it a couple of minutes, and then we will get started just to get people an opportunity to jump on. While folks are jumping on, there is a chat feature at the top on your teams. And so as we're going through the presentation today, please be sure to ask your questions through that chat feature. Um, I think the easiest way to do it is if you try and keep the questions aligned to the material that we're presenting. I know that's not always possible. And we will try to get to every single question that we can, but if we can't, I promise that we will individually follow up with you. And so I'll get a download of the list of all the questions that are asked. So we want to make sure we get everything answered. But we will, I think folks are still trickling in, but we will go ahead and kick it off. Good morning again, everyone. My name is Kritesh Patel. I'm the president of HPC. We're excited. We're going to talk about Ohio's Medicaid school program expansion today. And before we kind of get into the content, I wanted to set a clear expectation for today's conversation. And so everything that you see in this presentation is based on publicly available guidance issued by the Ohio Department of Medicaid, or known as ODM. This is not an official ODM presentation. It is HPC's professional and practical interpretation of ODM materials. So we want to provide you with the tools, resources, and guidance to roll out Medicaid expansion successfully in your district. There have been significant changes over the last year with the Medicaid school program in Ohio. First and foremost, the program is now almost fully managed by the Ohio Department of Medicaid, whereas the administrative functions were administered by DEW in the past. And so with this transition to ODM, there's been a clear expectation from ODM to communicate information accurately. We work hand in hand with them to ensure this expectation is met. So if there's any sort of conflicting information that is shared with districts by anyone, HBC will always defer to ODM for final guidance as the governing body of the Medicaid school program in Ohio. We're going to share these materials with you after the call. Likely next week, you'll get it directly from my email address. So please be on the lookout for that. Today's presentation is going to be primarily focused on the Medicaid school program expansion. So we're going to dive right in. We're going to talk through some really quick introductions, an overview generally of the Ohio Medicaid school program, and then we're going to dive right into expansion and talk through all of the details behind that. A quick who we are. So we're a Medicaid school billing company in Ohio. We've been here since 1993. This is me on the top left, and you've got Tracy, our vice president, who's done it for over 30 years here in Ohio. A lot of you know her. Pam Katz, Nate, Kevin, and Cheryl all work across our client leadership team. Before we jump into Medicaid expansion, I do want to announce this kind of exciting thing that we are doing is we are now launching a new monthly webinar series that's going to be hosted by us. And, this first one is around Medicaid expansion, a two-part. We probably will have a third part next week, just given all the school closures and snow days. But in February, and I think this is the one that a lot of people have given us feedback on and are excited about, we're going to be doing a Nursing 101 as it relates to school Medicaid expansion and best practices. So for the rest of these webinars, you'll notice we're actually going to be partnering up with people. It's not going to be just HPC. So for the nursing, Bob Bundy, who I refer to as like a living legend in school Medicaid across the country, he is a nursing expert and knows everything about all of the clinical practices. So we're going to bring together Bob's expertise on that side and then Tracy's expertise on the Medicaid school billing side to have this webinar on February 18th. That link has not been sent out yet. So here's my email address. Please reach out directly to me if you would like to attend. We're going to invite everyone that's attended these couple of webinars, but I know that there have been some folks that want their nursing leaders on there, that want their school nurses to be on this webinar. I think it's going to be really important because we're going to talk about documentation practices, not only as it relates to expansion, but just the overall Medicaid program. So if you want anyone particular on that webinar, please reach out directly to me. I will put my email in the chat too as we um, go on the presentation and leave this slide. And then in March, we're going to do an LEA roundtable. We're going to get your peers together on a call, and we're going to have a little powwow on Medicaid school program and how they're running it at their schools so that you can get ideas from other school districts and your peers. We have a couple of folks signed up. We have a couple of spots that are limited. If you would like to participate in the panel, be someone that answers questions, that interacts with the crowd, please reach out directly to me. This one's going to be exciting, so you'll hear a little bit less from us and a little bit more from your peers. In April, we're going to partner with the Ohio Department of Medicaid and an LEA, Paula Jones at Brooklyn City Schools, to present at OASBO. And this is going to be a general presentation on Ohio School Medicaid program and expansion, along with like ways to take advantage of it from a financial perspective, given that a lot of that is in the theme of OASBO. And then in May, we're going to partner finally with AJ Knapp at Ray and Associates, a CPA firm that does a lot of the auditing for the cost reporting. We're going to talk about kind of the finance 101 portion, cost reporting, indirect cost reporting, MER, different ways you can maximize reimbursements for your district. So be on the lookout for all of these links that come your way. You're welcome to attend any of these. So before we jump now into the content, and I promise I'll stop talking and turn it over to Tracy, who's a lot smarter than me on a lot of these things. This is going to be a deep dive into expansion. If you're interested generally in Ohio Medicaid School Program 101 session, right? You're new to the program, you want a refresher, please email me directly. We will either host that session with you one-on-one, or if we get enough interest, we'll have a webinar on it, and we'll make it a little bit more interactive so folks can talk to each other. And so please reach out if you want a kind of a one-on-one session. Submit questions via the chat feature. I'll be monitoring that. I've already talked about that. We'll try our best to address every question live. Won't promise that, but we'll promise to follow up. Last but not least, if you'd like to discuss how this information applies specifically to your district, you want us to do an assessment, an analysis, how we can directly help you take advantage of either expansion or the program as it sits today, please reach out to anyone at HPC. And we're happy to set that up one-on-one. Virtually, we're happy to come in person as long as it's not a school day and we're not driving through 18 inches of snow. We promise that we will try and make it your way. So please don't hesitate to reach out on that front. But I'm going to turn it over to Tracy so you can hear me stop talking and hear Tracy talk. So we're going to dive right in.
Well, good morning. Thank you for joining us today. HPC hopes that your school district today leaves feeling like you understand how your school district can benefit from the expansion program. To begin, we would like to give you a brief overview of what Medicaid is for the school districts. So the Ohio school-based Medicaid program allows school districts, community schools, state school for the blind and deaf to seek reimbursement for Medicaid eligible services provided to all students. That is a change. In the past, it was only related to IEP students, and now it is for all students. Your school district does have to become a Medicaid provider and is the payer of record. The services that are eligible to school districts to get reimbursed for are occupational therapy, physical therapy, speech, audiology, nursing, behavioral health services, transportation, and medical equipment and supplies. It's important to understand how the reimbursement model works for the program. It is a cost reimbursement model. So what that means is the school districts can get reimbursed by what it's costing them to run their program. So all of the costs, the salary and benefits and purchase services are then factored by the random moment time study percentage, as well as the school district's Medicaid eligibility rate. Once that is determined, you come up with an allowable cost. The allowable cost is really where that's what you can get. That's the max the school district can get based on what it's costing you to run your program. So as we look forward into this, you are going to see service areas that you can add that are new, or even ones that you have currently that you can start adding, like RNs or LPNs, and that will increase your allowable cost. However, the reimbursement is done on interims. So based on the documentation, school districts will get interim payments, and then they settle up with the annual cost report.
All right. So that's just the general baseline understanding before we jump into expansion. Tracy, we actually do have one question. Are DD schools able to get reimbursement?
I'm DD schools,
Yeah,
developmental.
yeah. What does that stand for? We can come back. I'll ask the individual what that stands for. Okay, let's jump in.
Okay, so in summary, there are 4 categories that are changing to the program. And as I mentioned, it is now for all students who are receiving Medicaid eligible services that the school district can obtain reimbursement. The biggest category is that we're adding new eligible service providers. There are 7 new provider types that can be added, specifically related to behavioral health and nursing services. So if you are adding new service areas to your program, that is going to increase your reimbursement based on incurring additional cost. The next is that there are new billable services based on CPT codes. So additional services are being added to the school districts to get reimbursed. So with adding additional services, you'll see as we go through the program, there are also services that will not require a care plan. So that is in addition to like vision for nurses. So that will potentially impact the interim payments to the school districts. And then we talk about the new school service care plan. And that is part of the program. You do need to either have an IEP or a service care plan that's approved by the Department of Medicaid. So if you're using this care plan, that will increase your interim reimbursement to the school district. And lastly, we're going to discuss random moment time study. Many of these changes you're already aware of. These schools are now required to participate in all 4 quarters that started this past year. So there are 4 quarters. You do need to send in a participant list for the first quarter, which runs July through September. Participants can only are required to respond 2 days. They only have 2 days to respond, as where in the past they had 5 business days. So it is important that all of these school districts make sure that their providers adhere to the guideline for the response time.
Yep. There's a question, if we contract those services through another agency, would that reimbursement go to the district? The answer to that is yes.
Yes, the
And
districts incurring the cost, correct.
correct. And then the DD schools able to get reimbursed, Tracy, that stands for developmental disabilities.
Right. That's what I did think. So I do know a lot of the school districts are running the providers that they pay for at the DDs, they run through the
Oh,
program themselves because they're incurring the cost. So I don't know if
so DD schools cannot get reimbursement. Sorry.
I was gonna
That
say, I
is,
didn't
yep,
think they actually, thank you.
yep. So DD schools cannot get reimbursement. Okay. Thank you. All right. We'll go on to the new eligible service providers.
Okay, so here is the list of the new eligible service providers. They are basically focusing on behavioral health and nursing services. So these are new to the program. So I don't want you to think that it's just these. If you're not already using your RNs or your LPMs, they could potentially be new to your program as well, because based on some of the new services that are reimbursable, you could add them if you're incurring a cost and they're providing any of the services. So based on this list, in addition to that would be any interns, trainees, or students. However, do keep in mind that the program is based on the fact that if you're incurring the costs, and they must participate in the random moment time study, and the services must be submitted by a licensed professional.
Okay. Any questions on the new provider types? Okay, we actually do have, okay, just a little bit of discussion going on. Here we go. Are days over school breaks? Oh, this is an RMTS question. I'm going to save that one for when we get to random moment time study. Okay. Any questions on the new eligible service providers? All right. Let's jump into the new billable services by service line.
Okay, so we came up with a little chart just so you could see based on each service area where you could potentially see some additional reimbursement, interim reimbursement based on the CPT codes that are now allowable in the program. And first, OT, speech, based on the new guidelines, if you're providing interventions and you create a care plan for those interventions, you can start getting reimbursed for those. And in addition to that, there's a new CPT code that's been added for all three service areas for caregiver training for activities of daily living. The next is behavior health services. So the additional services that you see that you can get reimbursed for would be therapeutic behavior services, um, screening for brief intervention for alcohol and substance abuse, smoking and tobacco use counseling. You can get reimbursed for that as well. And those two billable services areas do not require you to have a care plan in place to get reimbursed. Behavior nursing services and CANS assessments. So if you do have any of the licensed professionals who are CANS assessors, they can use the CANS CPT code for reimbursement. And then we talk about nursing. There are many services that were added for the advanced nurse practitioner and physician assistants. However, with your RNs and LPNs, there are additional services that you can also get reimbursed for, such as your screening for the visual acuity. And that code is not a timed code, it's an encounter code, as well as the inhaler treatments that you can get reimbursed for. And then there's preventative care screenings, but those are specifically for the physician assistants and nurse practitioners. And as well, the nursing services can use the screening for the interventions for alcohol abuse and tobacco use. And if any of the nurses are a CANS assessor as well. Down below, HPC kind of created a CPT code tracker, and that just allows you to click on each service area, and you can see what CPT codes would be available to the school, to the individual service area. It will tell you if it can be billed for telehealth or if a care plan is required. So we do have this tool for our clients that we can have them use to kind of identify if any of those services would be beneficial to the school district.
Um,
And I do want to
okay.
say that the CPT codes, ODM has been very good about that. They put some of the codes out. So we are kind of going back and forth to make sure if how they're used in the school. And I will say that also the Department of Medicaid continues to update and make those changes. And as those changes occur, we'll update our tool.
Yep. So if anybody wants a copy of our tool that we've just kind of made, please just reach out directly to me, and we can provide that. I think Tracy's plan is she's just going to make it a live document that's view only, and then we try to stay on top of. We take direction from the Ohio Department of Medicaid, right? So we won't put anything in there that they won't have, and so we'll wait for them to make any changes and then go make changes in our tool. So happy to send a copy of that. Tracy, we've got some excitement about learning about the care plans required for some of the stuff that you talked about. And then we also have a question. Are you are hearing screenings also eligible for reimbursement?
Cheryl, I actually, that's a good question. I know what's new is the visual screening. I can't recall if for the nurses, or are we talking about audiologists? I don't know the codes off the top of my head. So if Cheryl can check into that, we could circle back.
Yep, and we'll circle back on that question. So good one there. Um, if here's another one. If the Kansas assessment is done by Ohio Rise, How is it possible for the district to bill for that since Ohio Rise is a family-based service?
Those are really great questions. I think that when we did see that the Kansas assessor, we were discussing with the Department of Medicaid how that is going to work. I do feel that HPC needs to collaborate and get more information on that. As far as the rules in the Ohio Department of Medicaid, it does indicate that they can get reimbursed. But you do have to be a certified Kansas assessor. So that question is a valid question, and I think that we do need to work with Department of Medicaid to get a better understanding about the Kansas assessments.
Okay, perfect. So we'll follow up there. Um, there's another one that says, where does diabetes management fall?
So diabetes management, I mean, based on what service area, if you have a care plan in place, it all depends on you. Well, let's talk about the care plan. So you do have to have a care plan, and there is some management. It's treatment for the nurses. So if you have a diabetes care plan in place, that would where it would apply.
Okay. Something about last question on vision screenings can now be billed. Is that true? That's a
Yeah,
question.
yeah. It says visual acuity. And it does not require, that would be your state mandated screenings. And as I said before, it's not a timed code based on the 15-minute standard. It's an encounter code. So you may now be able to have some of your LPNs involved in the program, and where they in the past they weren't, because this is something that they are doing.
Okay. So that answered that one. So we've got a couple of questions we're going to follow up on the Kansas assessment on the Ohio Rise. We've got an RMTS question we'll cover later. Uh, there was a question on hearing screenings where we've determined SLPs can complete the hearing screenings, but we will just confirm that with ODM. And then we've talked about the vision screening, which can be billed for. So we'll move on to care plans or services, the Ohio School Services Plan of Care.
Correct. So we all know that Medicaid used to operate that you had to have an IEP in place for direct treatment and therapy for a child. ODM has introduced a new plan, which is called the Ohio School Service Plan of Care. So if the child's not on an IEP, this is the approach that you will take. So assuming that you have an approved alternative plan, which will provide you with the list of those, and that plan meets all of the criterias to be Medicaid reimbursed, then you would only need to fill out the first 3 pages of the new plan. So this plan now, it has to be included. So you have your IEP and this plan, and as long as you have an alternative plan and it meets all of the criteria set forth by Ohio Department of Medicaid, you will only need to fill out the first 3 pages. However, if the alternative plan does not meet that criteria, you will need to fill out the whole entire portion of the care plan. So
We do
next,
have links. We do have links to the Ohio Department of Medicaid site at the end of this presentation with all the resources that they provide, including a copy of this plan. And I think one important thing that we wanted to note about this plan is that like you make sure that you use the plan that's on the Ohio Department of Medicaid's website and no other plan. Like the one that they have is the source of truth and the one that everyone should be using. Um, sorry, Tracy, go ahead.
oh, that's okay. So here's your list of the acceptable, Department of Medicaid has listed this in their guidance as the acceptable alternative plans that you would have, as well as then attaching your new school service care plan. And if it meets the criteria, just fill out the first 3 pages of that, which is the demographics and the signature page that would need to be included. Okay.
Someone asked a question about this, just school services care plan. Said if a child has an IEP, should the service still go in there? I'm
Oh,
assuming
yes, this does not take, this does not take place or over any other school documents that's required. An IEP, it's still the IEP. You use your IEP or you would have to have an alternative plan with the Ohio School Service Plan incorporated attached based on what information is in that alternative plan. It'll define whether or not you fill out the whole thing or just the first 3 pages.
So I guess the same question followed up there. If the student has an IEP, do we also have to complete a care plan?
No, the IEP, it's either if they do not have an IEP, this is the approach you would take.
Okay. And then we talked about the acceptable alternative documentation.
And there's where I see, they say the diabetic management plan, if you have that in place, you can get reimbursed for that as long as you follow the rest of the guidelines by attaching the approved school plan.
Okay. Let's finish this.
So just as I said, that if you have an alternative plan, what are the guidelines and criteria that you need to meet? So this is just a list of the required components of your alternative care plan. So if they have all of these components, then you just fill out the first 3. If not, you then fill out the entire care plan. So obviously, you need to make sure that you have a start and end time on the plan. You put in the amount, frequency, and duration of the plan. Goals need to be in there. Description of progress monitoring and progress notes need to be included. And you need to also, if you're nursing, reference where the physician's script or orders will be held. And the reason it's important to remember all of this moving forward, this is a Medicaid program. And just like we've went through all these years, going through the agreed upon procedures where they test all of the documents, not only for that process, but any state or federal audit, all of these documentations need to make sure they're maintained in an appropriate location for access to for review.
We've got a question, Tracy. To confirm, we're going to ask our staff to fill in 3 additional pages of demographic information. Is there any way through our SIS or other software programs like SNAP, Same Goal, DASL to get that information populated? So, okay.
No, you can answer that one, Chris.
Yeah, we need to work offline with those companies to see who's willing to kind of populate that in there. Tracy, I think we talked about this yesterday. This was a question yesterday. It's something that this is so new to the program that a lot of these technology partners that manage your SIS are going to have to determine whether they store the care plan in there. But I think they would, right?
Again, I think it's up to each individual platform whether they do it. But as mentioned yesterday, this is a form that's created by ODM. So as long as they're okay with those being stored in their platforms, I would think that it would be nice to see them work together to make it easier for the school districts.
Yeah. Currently, we have to have family sign permission for us to submit to Medicaid, assuming that's parental consent. Now that this could apply to all students, we need to get that same permission from everyone.
That is correct. Parent consent does not go away. Everyone will need to make sure prior to billing or getting reimbursed for services that you do have parent consent obtained for all students that are participating in the program.
And when we say all students, we mean all students who are receiving an approved Medicaid eligible service. So
correct.
I wanted to make sure we clarify that. A couple of other questions. Do you have any recommendations regarding delivery of behavioral health services using care plans for students attending district and ESC public preschools?
That's a very, I mean,
Maybe one we
I
can
need
talk
more
about
specific
offline.
information on like really what is it that we're trying to accomplish. I don't know if it's like writing them or which ones they want to use. So I think that I need more information on that question.
Yeah,
But I do can I just go back to the parent consent? I do
sure.
want to say, parent consent does have to be obtained. I think there's many different ways and different approaches school districts are going to implement that process. And I think that would be a good webinar to attend with the roundtable. Maybe we could put that in as maybe an item that we can talk so other schools can kind of discuss what they're doing to make it easier for other school districts.
Yeah. Someone had made a note that on a side note, if you're an OT or PT or a licensure board does require that every person have a plan of care. In this situation, it is not a school district document or ODM document. It is a document maintained by the therapist.
Right.
So someone had mentioned that in there.
Yep.
Let me see. Any other questions? Um, the MSP rate is per hour, correct? Or is it per encounter?
No, it's all dependent on the appropriate CPT code. So every CPT code has a different rate of reimbursement as well as it's either an encounter code or it is a timed code. So depending on how the code is set up, each code is different.
Yeah. And if you want a copy of that tracker, just get in touch with me and that should give you some details on the descriptions of each of the CPT
Yeah,
codes and the requirements.
yeah, most of them will say minimally so many minutes. So it'll tell you if it's a timed code or if it doesn't, it's an encounter code.
Cheryl, did you want to jump in on one of the
Yep, I just
questions that
wanted
were
to,
asked earlier?
yep, about the Kansas assessment that is provided by Ohio Rise. Are you able to clarify who is paying for that service? Does the district incur the cost for that service? Or is that paid through the student's private insurance or in another means?
Yeah. So maybe that's a offline conversation. If you want to reach out to Cheryl, you can have that discussion with her.
I mean, the
answer.
basic rule of thumb is the district has to incur a cost for the service in order for the district to claim the cost.
Correct. And I think keep in mind, the Department of Medicaid has approved all of the reimbursement and delivery, what your services you're delivering is based on these CPT codes. And these CPT codes have been vetted and approved by the Department of Medicaid to be used in the school Medicaid program. So I just want to say that if we have questions about the cans, we will have to go back to them to get more guidance on it.
Yep. And Paula Jones just mentioned in the chat that typically Medicaid or private insurance covers all services done by Ohio Rise. So it's just a side comment there. Okay. Any questions on, before we jump into the RMTS portion of this, any questions on documentation, the new school services plan of care, the new providers, or new services that we've covered today? So Abby asked, so realistically, how this is a nuanced question, Tracy, so get ready for this one. So realistically, how quickly are districts getting this up and running?
That is a great question. And I will say HPC's approach is that we think you need to identify what services you potentially can add. And then make sure that if you're adding someone, are they going to be able to reimburse, get reimbursed based on maybe nurses, maybe they're just giving meds and it's taking 20 seconds to hand somebody something, but that's a timed code. Is that really going to be something you want to go through the whole process to add the care plan? And would it even be reimbursable to the school district? I think there's a lot of things all of the school districts need to take into consideration before they just jump into it. Now, there are some school districts that are really prepared because they've gone through the process to add in different platforms to help assist them get through the process. However, I think each school district just has to take a realistic approach and look and identify, how are we going to get parent consent? because ultimately, if you don't have parent consent, you can't get reimbursed. How are we going to incorporate these school care plans? And the most important that we feel is you need to make sure you're in compliance, make sure everything is in order, and you have a process to store the data. Because all of this in the past, we've worked very closely with the Department of Special Ed, and for over the years, they keep all their records, they have everything stored, they have the attendance records, the IEP, all of the evaluations, everything that you need to support the process. So while you can start these things before you do that, we would ask that you make sure you have a process in place to make sure that these documents are stored and you know where they're stored and available on the event of an audit.
Yeah.
So I think that I think as Brittany said, some school districts can look at this as it's optional. I think that every school district will have a different approach based on how prepared they are to move forward.
Yeah. I want to just expand on that a little bit is a slow down to speed up approach. Like it's okay to slow down and really think critically through, and we can help you, right? Like, hey, let's take a look at the list of the providers. This is who I currently have that I could add as it relates to Medicaid expansion. Let's take a look at the new services. These are the ones that, we are conducting today that we currently aren't submitting claims for that we can as a part of expansion. How do we get the processes in place so that when we launch it at our specific school district, everything's humming from a people process technology standpoint? So those are things that we can help with. But again, I think everyone's got their own answer. Mine is compliance. I think Tracy would agree. Like compliance and making sure that your district is operationally set up to be able to take it on. And I think that is the message. If school treasurers and CFOs are really pushing on you to say like, hey, we got to get this done. We got more reimbursement. We really need to sit down and do the math and then show them the plan from an operational standpoint. We're happy to walk through that with you. Someone We got to thank you, Tracy, with an all caps based on that answer. So that's our first all caps thank you over the last 2 days for the webinar. So that's great. Same goal would be a great way to get parent consent signatures as this can complete electronically. I feel like they would add these documents. So that was just a message by someone. Someone asked for parental consent, is there a deadline to have it? For example, all school nurse does vision and hearing screenings on students. Does she have to have the consent before doing the screening or before doing the billing for the screening?
Well, it depends. I mean, it's billing vendors cannot send in anything to Medicaid for potential reimbursement unless parent consent is obtained. So typically what happens is providers do not know who has consent. You'll document for all of your services that you provide. And then once that documentation is submitted, you'll match up to is parent consent obtained. And if it's obtained from the effective date that the parent signed, the billing vendor would then send it into Medicaid for potential reimbursement. So for screenings, that's a big process. So if you're potentially getting all of your parent consents at registration, and then you're just doing your screenings, it's up to the billing vendor to match to make sure you have parent consent prior to billing. And again, parent consent is based on when the parent signed.
Okay. Do vision
Bottom line,
screenings? Oh, go ahead.
all services are
Okay.
required to have parent consent. So you have to have consent for your billing vendor to send in the information to the Department of Medicaid for reimbursement. So if you have 10 kids that you're doing, you go ahead and document for them, and maybe only 5 of them have consent, and that's what the billing vendor would go ahead and go do. It's important that the parent consent is obtained, but also if you need to document the services, and then it'll be moved forward by reimbursement based on if it's obtained or not. So providers will not need to worry about that. School district management need to make sure they obtain it, but the providers will just document for the services. Okay.
So, yep, let's go on to random moment time study.
Okay, so these are the summary of changes. We've already talked about all of them, and you've heard them multiple times. We already know that contract service providers are now required to be part of the random moment time study. So they need to be included on the participant list each quarter. The response time has gone down to 2 days. It's important that school districts do make sure that their providers respond to these moments. School districts are held accountable. They do need to make sure they're 85% compliant on their responses. So they do have to make sure they respond to them timely. We added the new quarter, and then there is a new submission process. Department of Medicaid had a webinar last week, and they made an introduction to a new process, and they're going to have a webinar on February 19th to go over this process, as well as sending out communication. But they did indicate that effective the first quarter in 26-27, school districts are going to be required to submit the random moment time study participant list directly to Solix. So I'm sure at this point, HPC and all other billing agents are trying to see how we can continue to support our school districts in this process. It is rolling out, it's new information. We do have to wait to see what the expectations are and the guidance is from the Department of Medicaid before we can even respond to how this looks going in the future. However, we do want to make sure all school districts connect and are part of this webinar. If you go to the Department of Medicaid website for the school Medicaid program, which Kritesh does have all the links here, at the top of the page, there is a link to register for that webinar. And we really want to encourage everyone to make sure they are part of that so you understand the process.
Yeah, I think that's just to clarify that. I mean, it's all new, and so I think we need to wait on the Department of Medicaid to come forward with their guidance, and we'll cover their webinar dates, which we highly recommend everyone attends those, and along with the links that we have. Tracy, I think this is just more detail about
The changes on the random moment time study. So this is just a more detailed level about all the individual changes. I think the most important one is this new submission process, as we discussed. We really don't want to advise or say anything until Department of Medicaid has an opportunity to present what their process is. I do want to also let you know that the Ohio Department of Medicaid has been sending out correspondence to all of the school districts. If you're not getting them or the proper person is not receiving them, you can either contact your billing vendor, maybe they can connect with the Department of Medicaid to see who it's being sent out to, or you can always email them directly to find out who's getting those correspondence, so that then you can make a change so that the proper person is receiving that correspondence.
Yeah, there's a popular question that was asked yesterday. We'll ask it again today on RMTS. Is there any clarity about whether staff not included in RMTS may bill for Medicaid services? We have a few contracted staff members who do not have a consistent schedule and were excluded from the RMTS provider list.
And that is a great question. So as things rolled out throughout the year, there was different information that we received, so we do need clarification. So I know Cheryl addressed this yesterday. We received the same question. The response we received from Medicaid was that could be included on purchased services, but we also need to follow up to make sure, even though we want to make sure that their cost is then also applied on the cost report. So we just need clarification again. I think there's just been different pieces of information we received that I'm not comfortable giving that advice right now.
So I did get a little bit of clarification this morning, and
wow, well, that was fast, Cheryl. Okay. All right.
We're working in real time here. The Department of Medicaid would prefer that those random moment time study questions go directly to them for their response instead of kind of coming through the billing vendor. So that was one thing that was pointed out
Good. Noted. Um, okay. Thank you for that. Um, Someone had asked a question earlier about Snap, I think, and other documentation tools, especially nursing as it relates to expansion, but anything else. At HPC, we are actively either integrated or open to integrating with anyone that wants to integrate with us. This is like twofold here. One, if your providers are documenting in multiple systems, that sometimes creates an incentive for them not to document on one or the other, especially the Medicaid billing side, because we all know they have crazy caseloads. And at the end of the day, they've got to go out and submit all these claims for Medicaid. So we have already integrated with a number of different platforms, including Snap, SLP Toolkit, My School Therapy, Brawley. We're working on Infinite Campus. So the idea here is that your providers only have to document in one place, and then we still continue to do your Medicaid school billing for us. So if you're interested, someone had just emailed me that question. So if you're interested in that, reach out directly to us, and we can get that going for your school district. For the ones that we have done this for, it has been a big win for their providers. And especially with expansion, it's a lot more prevalent now. And so that integration is very key. So
And I just want to throw in that eliminates the question for the provider. Is this even a billable service? Is this even something I should document for Medicaid? I'm just going to document the service and let somebody else figure it out.
right. And it's our job from a compliance standpoint to understand what we can and can't submit, right, to ODM for a claim. So that takes a lot of the headache out of some of the questions that were asked before. So again, please don't hesitate to reach out to us, and happy to try to make that happen at your district. Do we want to quickly touch on MAC, Tracy?
Just as a reminder, MAC has always been part of the Medicaid school program. It's never been utilized. However, Department of Medicaid is really pushing to roll MAC out so school districts can get reimbursement. There was a tentative date of July 1st. However, we do believe that Department of Medicaid said July 1st-ish. So we will get more information on this, but MAC allows for school districts to get reimbursement for services that are provided by, they're not direct services, they're services that are provided on behalf of a student to make sure that they're accessing some type of Medicaid eligible service. And so this process is not like a direct service documentation. It's a process where you would get the list of these individuals, put it on the random moment time study, then submit that into it'll be a different cost pool, submit it to the random moment time study coordinator and vendor. And then these individuals will receive random moment time study surveys, and they would have to respond to them. So this is additional reimbursement that will be available to the school districts. And until all of the details are rolled out from Department of Medicaid, we're pretty much just letting you know that it's out there, it's to come, and it's not direct service, so they don't document this in a system as the direct service providers, but they will be included in a random moment time study process.
Yeah. So more to come. There's just we just need to wait on the Ohio Department of Medicaid to release more information. So this is just like a sneak peek, maybe something to get excited about potentially that's going to come down the pipeline. I did receive some guidance on Ohio Rise and CANS, and so I will read through that here shortly. However, I want to start here. So we're going to send this. A lot of people have asked if we're going to send this material out. We are going to send it out some point next week. And that material that we send out is going to include this page right here. And this page is essentially hyperlinked to the Ohio Department of Medicaid. They have done a phenomenal job of posting these resources online. So part of this is, our job as your billing vendor is to do our best to help you implement some of these things, to do our best to read through these documents and have you prepared. But there's also resources for you that like we highly recommend you check out. For example, a copy of the school services plan of care. ODM has that posted directly on their website. If you like to read a lot, they've got a nice guidance on the school services plan of care. We're happy to discuss that guidance with you one-on-one. If it's something you want to do on your own, you can go click into there. Obviously, they've got copies of the administrative code. They've got information on their webinars for specifically the random moment time study that's going to come up. And then, as Tracy mentioned, here's the email address for them. So we are happy to coordinate with them on specific items. However, if it's easier or you just want to reach out directly to them to maybe get added to their distribution list, here's the email to reach out to. And they're really responsive. And so, I think this is a resource that this is kind of supplemental, right? So this is between us and the Ohio Department of Medicaid. You've got two great sources of information, and it really starts with them. And we're doing a lot of the summarization of it. So we will be sure to send this out. Go ahead, Tracy.
I was just going to say too, as Cheryl mentioned yesterday, these documents, they're doing a really great job. They really want you to refer to these documents and not review potential copies. They are updating these real time. So sometimes there's changes and updates to them. So it's really good to come back here and look at the link because they do update this information.
Yeah. Yeah. And like if you ever have a question on the school services plan of care, I mean, there's two things you can do. You can go click into the link and go visit the Ohio Department of Medicaid website, or you can call or email us. And then what we'll do is we'll go click into the link and go to the Ohio Department of Medicaid website and grab it for you. So everything that we're going to get is from their website. And we're happy to be the middle person if we need to be. But we just wanted to give you these resources. We are going back and forth with the Ohio Department of Medicaid on the CANS assessment and Ohio Rise. And so that was a question I did not want to forget about. We will follow up with that. We'll probably release an FAQ document based off anything we weren't able to answer today. We'll try to release that next week and give you some more information there. But I believe the Ohio Department of Medicaid is actively working with Ohio Rise team on guidance for the Kansas assessment. So more to come there. Tracy, you want to quickly talk through this checklist that we put together?
Yes. So in closing, you ask, well, how do we prepare? What do we need to do? How do we look at this? So a checklist, the things you need to think about is, does the district incur the cost for any current or new providers if they're contracted or employed? Yes. If you say yes, then you would want to potentially add them into the program. And then you need to make sure that you've also included them on your random moment time study participant list. And also just by adding the provider, you want to make sure that are they really conducting some of the services that can be reimbursed? And that would be conducting some of those screenings we talked about, doing assessments, reassessments, evaluations, providing skilled physical or behavioral health treatment and therapy or interventions. So if they are doing those things and you're incurring the costs and you included them on the participant list, then they should be reach out to your billing vendor and they should be documenting so the school district will get reimbursed. And then if you are doing treatment and therapy, direct treatment and therapy with the child, you do need to make sure that the child's either on an IEP or one of the school services plan of care with an alternative plan attached, or the services plan of care completed fully. Also, make sure parent consent is obtained, and that is what would allow for a billing vendor then to send in the potential services that are documented for reimbursement. And also make sure you have a plan. How are you going to store all of these documents? The documents do have to be stored for 7 years or 6 years, 6 or 7 years, or until an audit's been adjudicated. So you do need to store the records and they need to be available. All of the supporting documentation, if you're doing vision screening. You can't just say you're doing the vision screening. You also have to have the results from that. And those can be pulled at any time. So you have to think about anything that you're documenting for and you're getting reimbursed for Medicaid. You have to keep all of the supporting documentation that can be reviewed in the event of an audit. So if all of that's in place, and you can then improve and increase your Medicaid program and get additional reimbursement.
Yep. Okay. Thanks. We got about
Okay, so update on the CANS assessment.
Cheryl works fast. Wow.
Thank you, Brittany.
Yeah.
So basically, it comes down to if the district is incurring the cost for the service. And if the assessment is done through Ohio Rise, the district is not incurring the cost for that, so it would not be a billable service. However, if it is a district employee or a contractor working on behalf of the district performing that CANS assessment, that would be a billable service.
Thank you. That's good to know.
Okay. A question, just clarifying, if a student receives OT services via 504 plan, not an IEP, the school district could complete the other plan and possibly get reimbursement for the OT services?
Yes, that is correct.
Okay. Transportation was listed at the beginning. What can be billed in regards to that service, Tracy?
Cheryl, do you want to discuss that? Because you created that nice overview.
Sure. So
Okay.
basically, these transportation need to be written into a student's IEP. The vehicle has to be specially adapted to support those needs. So wheelchair accessible, seat restraint, something like that. The services would be reimbursable or eligible for reimbursement if the student is receiving another eligible Medicaid service on the day they're transported. So if they're receiving speech services, if the reimbursement can be sought on the day the student is receiving a speech service or OT or PT. So it may not be every single day of the week. It has to be on a day that they're receiving another service. The reimbursement, the interim reimbursement, you'll find if we dig into this deeply enough, that the interim reimbursement is fairly low. The district is going to see the benefit when they file the cost report. There is other information that needs to be submitted with the cost report to support all of that. So we are happy to do an assessment for your district. If that's what you would like us to do, just reach out. We'll tell you the information we need and we can do a quick assessment for you.
And also, I just want to make it very clear, it is only for students on an IEP. This is not part of the expansion. It is still just for IEP students.
There's a question, any clarity on the 2-day requirement and whether that includes days over a school break for RMTS? I think, should we defer those, Tracy, to per ODM's request? Should we have those questions just filtered directly to ODM? Is that one you want to answer?
That's based on what Cheryl just said, that she got a response that sounds like ODM wants all of the random moment time study questions. I know that was a question that came up because this week a lot of the school days have been a lot of the schools have been closed and they're still getting the moments. So I don't know what I don't want to respond or say anything. I do know that ODM would like for you to contact them directly with those questions.
So I'm going to put their email address. We just want to respect that. And so I'm going to put their email address in the chat. And there you go. Who typically submits the transportation billing?
Who submits it? I guess it depends on how it's being submitted. If it's kept electronically, I guess I would need more context in that
Yeah,
question. Who
you can reach
submits
out.
it?
Oh,
You
go
need
ahead.
to keep attendance. So you need attendance to make sure that they were on the vehicle in the morning or in the afternoon. And I think that would be based on each individual school district, how that's being done.
Yep. So if you
Yeah,
reach
I
out
think
to us,
we can work
okay.
with individual districts and kind of go through the process with that.
Yeah.
So that information has to be gathered, provided to your billing vendor, and then the billing vendor has to match up to make sure that another service was provided on that specific day before it actually will send it in for potential reimbursement.
Yep. Okay. One
Okay?
last question, and then we've got to, I know we're at time. And so I thought I heard that paid intern providers are now eligible for the RMTS. Am I correct?
As long as they meet all the guidelines of far as what is required, you're incurring the cost and the interns, then as long as they're incurring costs, they're on the random moment time study, and then it's submitted into Medicaid appropriately with the supervision and everything falls into place. So um, it does need to be submitted by the licensed professional. It is, except because the rules do indicate that non-licensed services that are not submitted by non-licensed professionals are not reimbursed.
Um, Last question. There's a question above about FBAs. I'm on the spot
Functional
here.
behavior assessment.
Yeah, maybe. Can licensed social workers or counselors bill for them?
Yeah, because it's part of an assessment to determine whether or not their behavior is based on what, yes, that would be part of the process, I would imagine. It's an assessment to determine their mental status or behavior status, so that would be part of the process. I'm not sure which exact CPT code that would apply to, but we'd have to look at that further.
Yep. Okay.
Okay.
I think these are all great questions. Tracy, I'd say you did a pretty good job of getting thrown out on the spot with, I think, a lot more questions today than yesterday. For next steps, um, Tracy mentioned this earlier, right? Like, and there's a question, how do we, where are districts in all of this? Where do they stand today? And I think the most important step is ensure everything is in place compliantly for you to participate in expansion, and not just expansion, the program, right? Generally, for those of you that might need help there. So reach out to us, reach out to Tracy or Cheryl. I mean, they've just been doing this for a really long time in Ohio, and I don't know many other people that know it as well as they do. And so they're valuable resources. Reach out to me, and then I will probably direct you to them. So any one of us that you want to reach out to, we can help you. The Ohio Department of Medicaid is hosting a couple of different webinars for ESCs and for districts on random moment time study. I highly, highly, highly suggest that you attend those. We attend every webinar that Ohio Department of Medicaid has, and we try and summarize and put it into our words for guidance for you. But it's also better for you to attend as well, and so that you can get, that same information and you're getting multiple times. We've got the nursing webinar on February 18th. I forgot if that's a Tuesday or Wednesday off the top of my head, but it's on February 18th. I will send out that registration link next week. If you want to be on it, email me directly. If you want your school nurses or nursing leaders to be on it, email me directly. If you've got a friend down the road at another district that's got nursing and they want to be on it, email me directly. Like, I will get you that link. I think it's going to be a really great webinar. Um, as always, on an ongoing basis, continue to arrange training with us, one-on-ones for providers, for management. We are going to try and roll out a provider-specific webinar on an ongoing basis, for nurses, for SLPs, for OTs, for the full gambit. And so look out for that. And then continue to look out for any emails from us, from the Department of Medicaid, on any information that's upcoming. Again, we will continue to do these and do our best job of summarizing all this information for you. I'm getting a few questions on like sending emails about the upcoming webinars. I will send out registration links, but I'll put my email in here again. now that you have it. If there's ever any questions about those or the upcoming schedule, like feel free to reach out to me directly. Um, we appreciate everyone for joining. We know it's a snow day for a lot of you, so thank you for taking the time. We likely will maybe have one more of these next week, just to accommodate for those that weren't able to attend. So, and if we don't, then again, please reach out to us. But thank you again, and I hope everyone stays safe during these very frigid temperatures.
Thank you, everyone.
Please do have one more webinar. Okay, we will try our best to get that one scheduled next week. Thank you.